think what's very impressive, though, Christina, is actually when you combine selinexor with other drugs, and especially when you dose once a week, really the challenge of the tolerability becomes far less. And I think what's particularly interesting is how that, in fact, informed us regarding the pivotal Boston study, which we just presented at ASCO. But before we get there, I wanted to ask you, because you are a key investigator in the STOMP study, and you actually had first experience with some of the combination strategies.
Yeah.
Was that your experience too, that basically when you're able to administer selinexor weekly, combine it with other drugs, many of the side effect challenges that we dealt with in STORM were mitigated?
Absolutely, absolutely. We were pleasantly surprised with all the combination in the STOMP. As you know, they have 9 arms. But the idea was to have this new backbone, selinexor, dexamethasone,
Right,
combined with the
absolutely.
different agents.
Yeah,
And I was
yeah,
surprised too, because I was
yeah,
afraid that, in a certain combination, I was thinking I'm not going to be able to support the patient, but
right.
weekly administration was key. In this situation that we found ourselves with the COVID-19 pandemic, I think having another oral combination is important for some patients, so the less exposure to the clinic and exposure to other patients. So it's also another important factor of this drug. But I agree with you that toxicity was a different situation. In fact, the hyponatremia that they noticed that they had in the STORM with the twice a week were really not an issue
I
with
agree.
weekly administration. And of course, we learned that we had to go out of the gate with antiemetics, IV fluids, supportive care, but we were able to support patients. In fact, in some of the combination, like with the daratumumab, we will talk about that. I had patients stay on treatment for over 2 years, close to 3 years.
Right,
So it was
right.
amazing, at a very low dose.
No, I agree. And I think that was very much our experience too. And my experience since the accelerated approval of selinexor last year has been that when we combine it with drugs informed by your study, Christina, STOMP, specifically bortezomib and carfilzomib, as well as daratumumab, and the results have actually been really quite impressive, not only in terms of the ability to actually engender response from very aggressive, highly resistant myeloma, but also the tolerability profile.